In the 1970s, a couple immigrated from India to Liberia, a beautiful West African nation founded by freed American slaves, where the couple's son was lucky to be born. But in 1990, when the boy was 9 years old, rebels launched a civil war. The boy and his family were rushed to the center of town.
And there, on an air tarmac, we were separated into two lines. In one line stood my mother, sister, and I. We were hurriedly stuffed into the cargo hatch of a plane. And across from us stood another, much longer line with hundreds of poor Liberians. They had children on their backs, and when they tried to get in the cargo hatch with us, soldiers restrained them. They were not allowed to flee. As that plane took off, I saw their heads disappear beneath the clouds.
Raj Punjabi never forgot where he came from or the gross inequity he had witnessed that day. And as a 24-year-old medical student, he returned to Liberia to serve the people he had left behind. What he found was utter destruction, and not just empty shells where buildings once stood. The health system had vanished, with a mass exodus of doctors. If you fell sick in a city where the few remaining doctors worked, you would stand a chance. But if you fell sick in a remote village, you might die trying to get to the nearest clinic, hundreds of miles away. Imagine that your child, has awakened with a fever and you live far from any clinic. You know that he might have malaria. You'll need to carry his frail body on your back, paddle across the river, then hike for up to 2 days over log bridges and across the muddy jungle before reaching the nearest clinic. Delivering healthcare in the world's most remote villages is so challenging that it's no wonder many experts told them not to even dare trying. But Raj and his team chose not to listen. In 2007, they launched Last Mile Health, or Tiatine Health as it's known in Liberia, training villagers as professional health workers to bring care into rural villages. Last Mile Health has become a widely recognized model for effectively rebuilding healthcare in post-war countries. That summer, thousands of miles away in Malawi, Josh Nesbitt, a Stanford pre-med, worked at a rural hospital where 2 doctors cared for 250,000 people. Josh observed community health workers walk miles to the hospital each week to hand-deliver paper reports on the patients in their villages. But he also noticed that his cell phone got better reception in the tiny village of Namatete than it did in Palo Alto.
So I bought 100 phones at $10 a pop, a laptop, and a flight back to the hospital. We trained the community health workers to text message, gave them solar panels, took it off the grid, mapped where the phones had been distributed, and all of a sudden these remote community health workers were connected to the hospital and its resources.
Recognizing that they could use readily available tools to improve healthcare, Josh and a few fellow students launched Frontline SMS Medic, now called Medic Mobile.
We could provide 1 million community health workers with cell phones. Pair that with the technology and the partnerships we're developing at Frontline SMS Medic, and I get a little choked up. We could provide better healthcare, help clinics provide better healthcare for more than 50 million people. Those are really big numbers, but we can do it.
And a few years later, Medic Mobile is doing it. They're improving health in underserved communities across the globe using mobile technology. Today, we're pleased to announce that Josh Nesbitt and Raj Punjabi and their teams have joined forces to provide 21st century frontline health workers with the technological tools they need to save more lives. We're proud to support their collaboration through the new PopTech Impact Fund.